Good afternoon. Nurse Allen coming to you today from Healing Healthcare Training Institute here in East Point, Michigan. Today I'm going to be bringing to you one of the first of many new videos. Today I will be going over medication aid. That is a new program here in the state of Michigan. And I want to kind of shed some light because I see a lot of the students or candidates that come in, they're having a rough time navigating through the system because it's a fairly new program and what they are taught in their classroom. So today I'm going to try to simplify when you come in so that they can kind of relieve some of your test anxiety. So the first thing I'm going to go over, you want to make sure you get there on time. You want to make sure that you're 20 to 30 minutes early. You make sure you have on your uniform. You cannot come in a polo and khakis. I know some places that is their formal uniform, but they do not allow it through TMU Headmaster. So you have to come in a uniform. So make sure when you come in, please make sure that you come ready, prepared with your ID, valid ID, might I add. Make sure you have everything that you need and you come ready. So what will happen is once you start, the way it works with headmasters, this proctor cannot be in the system at the same time as you. So once you log in, she's logging in to get a start code for you. So once she gives you your start code, you have 25 minutes for maybe 1 to 2 skills. So the first thing I just want to kind of go over is how the setup is. Now, this is my makeshift setup, and I just want to kind of bring it into light. You may see a real med cart, but this is my med cart, and it serves the same purpose. So my top cart is all of my blood pressure supply, all of my vital sign supplies. So I have a pulse oximeter here. I have a blood pressure reader here. I have a thermometer here. I even have my little Narcan spray here. I have a pill crusher in here. I have a calculator, and I have an oral thermometer, and I also have an AccuCheck machine in here, and scissors just in case. That is my top drawer. And I also have measuring tape just in case whatever you're doing, just to make it feel just like you would when you have a real med cart. My next cart is all of my cups. So these are my souffle cups, my medication cups, my straws, Q-tips, just in case you have or need anything. Now, most carts are set up this way, but most of the time when you're doing a real cart, the top cart is usually all your over-the-counter medications that's kept on the top of the carts. And then at my top cart, the bottom cart starts my medications. Now for the skills test, you're going to have medications. So I have my little barrier trays so that they can put their barriers down. My next tray is my blister packs, where all the blister packs are. And then the last but not least is where I keep my medications, the main medications for the patients. So you'll have a cart, and it may be similarly set up the same way. Sometimes you have on your cart, you'll have your sharps container that's connected. So if you have to dispose of some sharps, you'll just put it on the side of the cart. It'll be on there. Now, on the top of my cart, some of them have where they have a little tower where you can put your computer at. Mine's, I have my pitcher for water, my ice water that's here. This is my water pitcher. I have my hand sanitizer. I have my night crusher that's right here to crush any medications if it was necessary to do so. I have my tissue, and I have my cups. And if I needed to, I would have some pudding on the side just to make sure. That's typically how the average cart is set up. You'll have all your supplies that's readily available at your disposal. Okay, so once you come in, generally your test observer will go over how their setup is, how it's set up in their facility, and where all your things are. So I just went over how the cart is set up. Okay, So once I know where all the medications are, then I will kind of give you a little quick synopsis of where my gloves are. So I have my gloves and my hand sanitizer because this is a clinical setting. So everything is set up to be readily available so that when you need it, it's right there. Now, I want to go over the things that you're supposed to do. Once you come into the clinical setting, you only have 25 minutes from the time they hit the start code. And those 25 minutes go like that. So when you come in, you want to come in ready, prepared to take that test. Now, you have those 5 checks that you have to do. So the first check should be when you're pulling those medications. So let's say she says you have, after you sign in, she'll have you sign into the system. Once she signs in, you're going to have a start code. From that time of the start code, she's going to read you a scenario. The scenario may say you have 1 o'clock medications for Miss John James, whoever they give you. So let's say they say, Miss Johnson, you got medications to give. So let's say they're going to give you, you have 2 medications that they'll have you to pass for that particular resident. So the first thing I would do is do your first check. My first check is when I pour my medication. So let's say after I log in, I'm not logged in, but I'm just showing you if I logged in. Once you log into the system, you're going to go to the patient's med sheet. So on the top, I'm going to kind of try to figure out a way to incorporate where you can see the med sheet. So the med sheet looks similar to this. So you're going to have a med cart and it's going to look similar. The med sheet is going to look like this. This is like a generic sheet. I'm going to put one in the system so that you can see it. I'm going to try to figure out a way to put it all in the system so that you can see them. So on this, it's going to show you today's date. Today is June 26th. So all your medications that you would be given, the patient's name would be at the top, and it'll also be here in the corner down here at the bottom. So once you're reading that patient's name, you would go look for that patient's name on that MAR. The first thing you're going to do is go to the med sheet. So across the tab, it's going to have med sheet text and submit on the top. So once you go in, you're going to go to med sheet. And it's going to pop up a sheet like this. And it's going to say, you got 9 a.m. meds to give Miss Johnson. So once you know what time you're giving Miss Johnson her medications, at that time, it's time for you to start pulling your meds. So you're going to look at your med sheet. So I'm going to just, let's say, for instance, this is on my MAR. I'm going to pull it back out, but I'm just going to sample, put this one out here. And I'm going to sit it on top of my computer as such. This is my MAR. So that is the MAR that will be in the system. So once I know who I'm pulling my medications for, so if she told me I had 9 a.m. meds for my particular patient, at that particular time, I'm just showing you this. So it's kind of looking a little sloppy right now, but I'm just showing you what I would do if I had my cart. So once I've signed in, it's going to bring you to a med sheet where you're going to see the MAR. At the top of that MAR, it's going to have text, and you're going to open up that text, and you're going to find your patient. You're going to scroll up. Now, this is the part that's really kind of challenging for the students. If you don't have a mouse on the computer, you got to learn how to navigate this computer. So the first thing you're going to do, you got to navigate, and sometimes you have to drag it into that particular box. So when I say drag it, once you get into the system and find out what medications you're given on the 26th, you're going to pull those medications, and you want to make sure when you initial that you're putting it in the correct box on the correct line. You may have to drag it to make sure it's in there correctly. It doesn't always go in there like you would normally see like in a POC or the EMAR system, depending on what system that you're accustomed to. It will be on a system where you have to drag it. So normally if you're giving medications today, all those medications will be already on today's date. And you'd have to filter it to change the date if you had to give a medication later or go back and maybe you forgot documentation, which you're not supposed to go back. But if you had to go back and correct something, you could go back and filter and go back to that particular time and give a medication that you did not give. However, when you're looking in a system, you want to make sure that you're looking at the correct date, the correct time, and it's going to look something like this at your school. They're probably giving you something like this to look at, and you do have pre-tests to take. But when you get to the facility, everybody's computer navigates differently. But what I do find is that all of them navigate, you have to drag it to make sure that you're putting it on the correct line to make sure you're dating it. So once you get to that, it should look something like this. So your first check should be Miss Allen. She's born 6/18/1920. I'm going to give her 9 a.m. meds. So the first thing, that's my first check. So my first check is identifying my patient. So the next thing I would do is be going to all my blister packs looking for that person's name. Once I find that patient's name, I'm going to pull those medications and I'm going to set it out there. I'm going to set it. That's my first check. Now that's my second check when I'm pulling. So if I have 2, 3, 9 a.m. medications, I would pull them, sit them right there. Now that's my second check, me pulling those medications and getting them ready. The next time I would get now I'm going to get my barrier out, have my barrier ready, and depending on what medications I'm giving, I'm going to get all my supplies ready. So all my supplies would be ready for me to execute. So the first thing I'm going to do is get my souffle cups out. So I'm going to get my souffle cup to pour my medications. So I would hand sanitize. I would do my hand sanitizing. Now I'm getting ready to pour my meds. So my third check would be, I'm giving Miss Allen Diovan at 9 a.m. I would at that time pop my medication, pop it in there. That's my third check. Now my next one is going to be my next medication. I will pop that one, put that one into a cup, and I'm going to look at that. That's my check. So before I put those medications back into the cart, now that's my third check. Now before I put these medications back in the cart, I'm going to double check them against the MAR again, making sure I poured everything. Now I would pour my water. I get my cup for my water. So I would grab my cup, get my water, pour my water. I have all my supplies. Now sometimes they may give you a nasal spray or some kind of spray to put on. Usually it's always one skill with a spray or an eye drop. So if you had those two skills, so let's say these are your medications and there's no eye drops. Maybe you have one where you have a pulse ox to do. So the first thing, before I even pour that medication, I'll have it out, but I'm going to also make sure that the candidate has a proctor that you're going to check their pulse ox on so that you can have it, and you're going to remember that number because you have to document it, because it may say do not give if pulse is less than 60. So if you have a medication, you want to always make sure you're double checking to make sure there's no parameters that needs to be in place before you administer that medication. Now your last check is going to be making sure you got all those medications with the right route. It says right drug, right time, right resident, right route. And then also at the end, your documentation. As our nurses, we always say the right documentation. So you want to make sure that you've done everything. So now you got all your medications. You should have done all your checks. You're going to lock your cart, take your key, close your MAR. Your MAR should be closed. Then the next thing you're going to do is knock on your patient's door. Knock, knock. Good afternoon. My name is Tanita. I'll be your medication aide today. I'm here with your medications. So the first thing I'm going to do is give my patient some privacy. So I'm going to give my patient privacy. And then I'm going to go into the patient's room. I have my barrier with all my medications on it. So my medications are there. So I have my medications, and I'm going to sit my patient up as high as I can get her. so that she can take her medications. But most of the scenarios, the patient will be in a wheelchair. Sometimes they may say the patient is in the bed, but you just want to have all your supplies. So now for you to see what I'm doing, I have my patient in the bed, and now I'm going to give her her medication. So, okay, Miss Allen, so the first thing I'm going to do is check to make sure I'm giving the right medication to the right patient. So I'm going to check her wristband and make sure everything is aligning. This is Miss Allen, date of birth 6/18/20. Her name tag should say everything that matches in the system. That's your other check that you just done. Now that you've checked and made sure you're giving the right patient her medication, you've sanitized your hands, you're going to give her a sip of water, and you'll ask her, can she take her medication on her own, or does she need some assistance? So if she needs some assistance, you'll give her a sip of water. Then let her know you're giving her her Diavan, her medications. Then you'll tell her what her next medication is. Maybe this is some lisinopril. You'll give her her medications. Give her some more water. Do you need anything else? Maybe you might need some tissue or something to give her to wipe her mouth if she was dripping a little bit. You'll do that, have all of that. Okay, Miss Allen, I've gave you your medication. There's your call light. You need anything else? Okay, so now that I'm finished giving her her medication, I would open up my privacy curtain. I would let the head of her bed down if she wanted it down. Now I'm going to discard all of this into the trash, so that is thrown away. Now this is the time you're going to come over to your computer. And once you get to the computer, you're going to go to your med sheet. So the first thing you're going to do is going to go to the med sheet. Once you get to the med sheet, you're going to tap on med sheet. You're going to hyperlink the med sheet. It's going to open. You're going to have to open it and scroll up so that you can see the entire sheet. Then you're going to go to the side where it says text. So once you go into the text, that's when it opens up so that you can make any kind of, make your documentation. So you'll find that date that you're on. So today's date is the 26th. So I would go to the 26th on my MAR. And I would, because the whole month calendar is showing for the med pass. So you want to make sure that you're documenting for the correct medications. That'll be your last check. So you're going to make sure you're documenting. So the first thing you'll do is document on that date all the medications given. Then you're going to come to the bottom. They have a legend here that goes off if the patient was there or not there. If it was they were there and they were given, you would go to that last line where it says medications given. It says meds given in day program. You would mark there. So you're going to create a box. So you're going to have to click the box to under the text and put your initials in the first box. Then you're going to have to double click again in another box, and then make sure everything is dragged into the box and signed on the line next to it. You will put your full name on that next line in credentials. The next one at the top, you're going to go back up. You're going to scroll back up to the top, and you're going to go to the review tab. The review tab is going to show you if you did your medications right. So it's going to just give you that opportunity to go back down and make sure everything is appropriate. If it's on the right line, the right time, the right medication. If it's not, at that time, you can make the adjustments. You can go right back in and edit and go back in and make any corrections at that time. Because once you hit submit, you can no longer go back and change that medication. Once you hit that submit button, anything done in review, you can go back and correct. If it's done after that and you hit submit, you cannot go back and fix it. So once you've done that, you're going to go back and you hit the review tab. Now, if that's your first set of medications, there's going to be a tab at the top that says next task. It's going to be always 2 tasks. So then you'll go to your next medication task. And then it may have parameters, and you're going to go over the same thing that we just went over here. At the end of that skill, after you've documented, you cleaned your hands, you would go and just start over again with the next set of tasks. You only have 25 minutes. So I tell people, please make sure when you're ready, you come prepared. You're going to have to drag the marker. The computer does not work like you see them when you were doing it in clinicals or when you were in school. They don't have it like that. It's a drag. You have to click and drag. So once you click and drag and then you put it in there, I think that's where a lot of the people's anxiety, because they do not know how to use the computer. Everybody's computer is different, but what I've been told and found that the system is the same no matter what computer you use, is how to navigate through the system. So hopefully this was helpful. I will be bringing you videos a little more clearer so that you can see when I have it in the system. Once I figure out how to navigate it to have it on the system, I will bring that to you. Please click like, subscribe, and share if you would like to see more videos like this. This is a very new program, but I'm telling you, you only have 25 minutes. You have to be precise when you come up and you're ready. And it's really just navigating the computer and knowing how to use the components. Please like and subscribe and share again. And thank you for looking. And I will be bringing you videos in the future. Thank you.